occupational therapy is changing from a master's degree to a required doctorate. Is that correct?
Well, sort of.
Okay.
The profession's having discussions. So part of the field is very committed to entry level. To get a license as an occupational therapist, you have to have a doctorate degree. Part of the professions is we don't want to put so much education dollars, expenses to students when they graduate. It's going to take them longer to pay off their debt. So we've got these two camps, and it really comes down to what is needed to practice. And we're seeing in many areas, if you're working hospital setting, acute care, those sort of things, the doctorate has a lot of advantages because there's so much you need to know. So patients don't die because you don't catch their AFibs going on. So there's so much training, the volume of knowledge that needs to get into a student takes years and years. So I personally believe that if students are going to do the amount of work for a doctorate, they should get a doctorate. When you look at many of the master's programs, you look at the number of credit hours a student does from freshman year in college to degree completion. That number of credits in many of the master program is enough credit hours to be a doctorate. So that's where I just being just that if we're the program we've designed at NKU, I think is just for our setup, where they're going to do that many credit hours, so therefore they're going to get the doctoral degree. Now, there are some master's programs that are great fits and do have a very reasonable workload, where students are starting in their sophomore or junior year and taking some of the occupational therapy classes. So it's a blended bachelor's, master's, and then those have a very reasonable workload. And they're very just. So shopping is important for a program.
That's great. It's always interesting to hear what's going on in everyone's industries. Things are always changing.
Mm-hmm. So the regulation now is it can be master's or doctorate.
Okay.
And the university gets to choose which one they're going to offer, and there's different standards. I also want to clarify, we didn't go over an occupational therapy assistant.
Okay.
That is an associate degree or a bachelor's degree. And the assistant does just the delivery of intervention and can help with some of the assessment. The occupational therapist has the whole process, from assessing a client, determining what the goals are, what interventions are appropriate, delivering the interventions, and then following up the quality control.